I need to keep pressing you on this. How far are we away from tougher national restrictions?
Well, I think very clearly the Prime Minister has kept setting out why we need a national framework, but very much a localised approach. You know, in different parts of the country, the southwest, for example, the number of infections is very low in comparison to what's happening in Liverpool. And it's right that there are different treatments, but everything continues to be considered on a regular basis. The tier levels are reviewed fortnightly on what might need to change in order to try and stop people having to go into the next tier. That's an important part of the review process.
You have a moral duty as a politician. If people are likely to be losing their liberty in some form as part of a national lockdown, circuit breaker, whatever you want to call them, to tell them as soon as possible.
Well, that's why we've taken this approach of the different tiers, trying to have the national framework but localised lockdown. As I say, we have had votes on this last night in Parliament about that approach, which got the ringing endorsement of Parliament. And it's important that we try and keep that measured step. It's about protecting lives and about protecting livelihoods. But it is important that people in different parts of the country who feel they're doing their bit have recognised the national measures are necessary. But there are definitely parts of the country where the infection rates and the hospital admissions are escalating.
So we're not going for a national lockdown in England?
I do not believe that the Prime Minister wants to set off on a national lockdown, but as ever, he is advised by scientists. He takes that decision in the round and tries to understand, and he set out the strategy of national framework, local measures.
We are not heading for a national lockdown in the next 2 weeks?
I don't believe that is the case, but as I say, this will continue to be a decision that the Prime Minister will lead on in order to make that judgment. So far, we have the 3 tiers, and we need to make sure that we give that the chance to work.
The Labour leader thinks that we're in danger of sleepwalking into a long and bleak winter unless we have a national lockdown. He's wrong?
Well, one of the reasons why we took the national measures is recognising what's coming ahead with winter, other sorts of respiratory viruses that will be in circulation in the community. So it's taking this approach now in order to avoid significant problems later. So that's part of the approach of trying to have that balance between, as I say, lives and livelihoods, but a total focus on what we can do to try and stop the issue in much more local areas.
See, I'm surprised you're saying that, Ms Coffey, with all due respect, because I was expecting you to bat away any thoughts of a national lockdown. But what you're saying is that it's not happening, as far as England is concerned, anytime soon.
As I say, we've got this approach, 3 tiers. Again, as all these things are often under review, but right now, and absolutely is the way ahead, is to try this and keep to, as long as people stick to the rules, we'll be able to manage any restrictions locally. And that's what really matters, I think, for communities to make sure that they do their bit locally.
The other states of the Union, Northern Ireland, they look like they're about to impose a circuit breaker. Obviously, similar measures being considered in Wales, and Scotland already has very strict measures. Is that not telling you something?
Well, in Northern Ireland, we're seeing very large rates in places like Derry City of over 800 infections per 100,000. That's a massive difference to, say, somewhere down in Cornwall, where it's considerably lower than that.
Nottingham, though, is very high.
And that's why Nottingham got put into Tier 2, so there is a higher amount of restrictions than would be the case in some of their neighbouring counties.
Are you being influenced by your backbenchers as opposed to the scientists?
I think that the scientists have been giving analysis for the past many months. And as Professor Whitty said the other day, we're giving some specific evidence and advice on COVID. But Chris also referred to the fact that there are many other factors, other illnesses, other treatments that people need to have. So it's right that the Prime Minister, advised by officials, advised by his fellow ministers, makes that judgment call on what is the right approach to get that balance of making sure that we tackle the virus to stop to avoid lives being lost, but also continuing to make sure that for parts of the country where the level of infection escalation is not as high, that livelihoods can also be well and truly protected.
In order for this to happen, you need the public to abide by the rules. Have you seen the pictures from Liverpool last night?
I have.
I'll show them to you again. I will certainly show them to my audience. Thoughts?
I'm very saddened by it. It's it's a city where I grew up. It's a great city, and of course the closure today of those bars and pubs where you can't get a meal or don't have a meal with what you're going to drink is a big change for people. But frankly, I think it's irresponsible. I think it's really disappointing, and it's gatherings like that which unfortunately don't help in any way to bring down the escalation of the virus.
Well, it's not
infections.
just in Liverpool. We've seen it in other parts of the country as well. We've heard from Sadiq Khan. It looks as though he wants to take London up to Tier 2. We see celebrations in the heart of London every weekend. If things like that continue to happen, does that mean that we potentially are heading for a national lockdown? If young people continue to party like that, what is the implication, I suppose, is what I'm asking.
Well, as I say, national framework, local delivery, if at some point the Prime Minister makes a judgment call, but we are not in that place. We have set out very clearly localised measures in order to keep that restriction. You know, it's not really fair, as I say, on the people of South West or Suffolk when they are doing their bit to try and control the spread of infections. They've taken on some national measures which are helping, but those are things that matter, I think, in order for communities to keep buying into the strategy and to make sure that we can schools can still be kept open, hospitals can still be kept running all those other treatments, not just COVID, and that people can freely go to and from work. Of course, people should work from home if they can, but it's the element of bringing the country together to do their bit locally on, you know, hands, face, space, and it's those three key things which, if everybody did it, we'd be able to bring this virus under control.